Hello there. This is Dr. Leslie, and hopefully I'm trying to record on Facebook as well as Instagram, and my Instagram is not behaving at the moment, so I am not positive if I am recording right now. Let me try this again. Interesting. Give me a moment. Never had this problem before. Does not want to cooperate here. All right, not exactly sure what's going on with Instagram, but I'm going to keep on going. So I am Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And welcome to another edition of 2-Minute Emergency. So this is actually episode 31, and the subject for today is sore throat. So everyone gets a sore throat from time to time, and there are lots of different things that can cause sore throats. It can be anything from just chemical irritants to your allergies, to even people who snore and sleep with their mouth open, and thus your throat is just dry, nothing more than that. So other causes that we get a little more concerned about are things like infection. So is the infection a bacterial infection or is it a viral infection? The viral infection, most common cause is the adenovirus or the common cold. Other things that can cause it include simple things like, it can include chickenpox. Never would have thought about chickenpox causing a sore throat, but it definitely can. It can be the flu, which can also cause a sore throat. As you know, one of the symptoms of coronavirus is also sore throats. So there's a lot of viral components that can cause it. But I'm going to talk a little bit more about the bacterial, and the one we think of the most often is strep throat. People tend to get strep throat on a regular basis, once a year. Some people even get it multiple times in the year. And if that occurs, those are the people that we want to have their tonsils taken out. I'm not going to go into that too much right now. So if you start to have a sore throat, what's the first thing you do? The first thing you do is you try the basic over-the-counter pain relievers, anti-inflammatories. So you want to try acetaminophen, you want to try ibuprofen, lozenges, and most of all, you want to do your gargling. So salt water gargling, nice warm water, you want to do that multiple times through the day and see if you get relief. Now, I work in the emergency department. There is not a reason to come to the emergency department right away if you haven't at least started off with these basic things early on in your course. Now, if you start to develop fever, if your pain starts to get worse, if you start to have more painful swallowing, but any difficulty swallowing, that's when you come to the emergency department. Because we need to know at that point, with testing, whether that is a bacterial cause or a viral cause. Testing for that is very simple. We just swab your throat. And that is something we call a rapid strep test. And if that's positive, we start you on the appropriate antibiotics. We check and make sure you're not allergic to any antibiotics, anything like that, and then treat you accordingly. Times to go back to the emergency department is if those antibiotics aren't working. If you've completed the course and you're not any better, if you continue to have fever, chills, body aches, anything like that, we're concerned about something more serious. The most serious thing that we worry about is making sure that after just having a simple irritation, which with strep throat, you tend to see those little red patches in the back of your throat, or even white patches. Sometimes they can even be gray. And you have swollen lymph nodes. You're going to feel it. You press and it's very tender. That is something that if it doesn't go away after you've been on the antibiotics, you've been trying the regular things, come to the emergency department, because you can also develop an abscess. If you develop an abscess, there's going to be a couple of different places. If it's in the anterior part, right about here where your jaw starts to, we call it the edge angle of the mandible, but right in here, one of the side effects is you get what's called trismus. Trismus literally means the difficulty opening your mouth. So not only have you lost your appetite and your throat hurts, but now you can't even open your mouth to eat when you want to. That's something that indicates that more serious infection is going on. Another thing is people come in with what we call a hot potato voice. And imagine if you're trying to talk with a potato in your mouth. It's not that your speech is slurred, it's not, but it literally sounds like you have a hot potato or some cotton stuck in your mouth. That's something that tells us, once again, something more serious is going on. If it's back further, it can actually cause a problem because that abscess, not only can it push and block your airway, but it can also erode into your carotid artery. That, of course, can be deadly. Now, this isn't something that happens just like that. It's not going to happen in 10 seconds or something like that. But you want to make sure that you seek medical attention if you're having worsening pain, difficulty opening your mouth, you're unable to drink, because the other side effect, of course, is you're going to become dehydrated if you're not drinking properly. So well, first of all, we need to make sure that that's not an abscess. And we do that with a CAT scan. Doesn't take very long. There's nothing painful about a CAT scan. It's literally taking multiple pictures at different levels so we can see exactly what's going on inside. The treatment, if we find an abscess, depending on the size, is antibiotics, but can also involve surgical drainage. So that's what makes it so much more important than just your common sore throat. So those are the reasons when you need to come into the emergency department and when you can stay home. If you're able to drink plenty of fluids, your fever is under control with ibuprofen or acetaminophen, it's painful to swallow, but it's not anything major. You're not in danger of becoming dehydrated. Try staying at home first, seeing how things go. If they progress, come in and see us in the emergency department. So I hope these hints were helpful to you. Please, if you found this informative, share this with your friends and follow me here every Tuesday, every Thursday, as I bring you another segment of 2-Minute Emergency. Once again, I am Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring these segments to you each week, twice a week to be exact, in order to help teach you and educate you about emergency conditions and how to keep you safe, healthy, and out of the emergency department. Until next time, have a great evening, and I'll see you back here. Take care. Bye-bye.